Welcome to this episode of the Clinical Podcast Series, brought to you by the American Academy of Optometry Foundation. Today's episode is multi-frequency RF combined with IPL improves signs and symptoms of dry eye due to meibomian gland dysfunction. My name is Kaleb Abbott. I'm an optometrist and assistant professor of ophthalmology at the University of Colorado School of Medicine, where I practice in our dry eye clinic. And I'm joined by Dr. Anna Tichenor, who's an assistant professor at Indiana University and the director of the dry eye clinic there. We are absolutely thrilled to have her join the podcast today, as she is one of the IPL experts in our field. This is an exciting topic for those who are performing procedures like this or people who are considering to perform procedures for the treatment of meibomian gland dysfunction in their office. Hi, Anna. Thanks for joining us.
Hi, thanks for having me here today.
Yeah, of course. So what was the purpose of this study?
Yeah, so I am really excited about this paper. So this study essentially wanted to look at the effects of combining intense pulse light therapy treatments with radio frequency and performing meibomian gland expression in order to treat patients that have MGD. So really looking at that how that additive effect of radio frequency can improve outcomes or not.
Mm-hmm. And to my knowledge, this is the first study that's investigating that combination, IPL, RF, and meibomian gland expression. Is that correct?
Yeah, I think so. This is definitely the first one that I've seen. So it's
Mm-hmm.
exciting to see.
So for our listeners who may not be familiar with these procedures, can you explain the differences between IPL and radio frequency?
Yeah, so essentially when you think about IPL, think about it as being a broad spectrum of light. So you have a lot of frequencies and wavelengths of light that can be delivered to the skin. And we use different wavelength filters to really filter that light into targeting different elements in the skin that are found at different depths. And then when that light kind of hits those targets in the skin, it's absorbed by hemoglobin that's found in telangiectatic blood vessels that are growing in response to inflammation. So that interaction between the light and the hemoglobin causes that blood to coagulate, and that vessel then closes up. So then as a result, what we get is this reduced inflammation and reduced levels of inflammatory cytokines that are reaching the eyes and being delivered to the skin tissue and the eyelids as well. So IPL also has the ability to kill Demodex and can also alter and improve the composition of meibum. Whereas radio frequency in some ways is a little bit kind of simpler to understand. It essentially causes vibrations in the skin tissue, which generates heat. And then through that process, it can also then stimulate skin tightening, rejuvenation of the skin, and collagen synthesis.
Mm-hmm. So can you talk about how this study was conducted?
Yeah, so this study, they enrolled patients and with MGD, and they used 4 sessions. So they did four treatments that were spaced 2 weeks apart, where they did 10 minutes of IPL, then they did 10 minutes of radio frequency, followed by kind of expression manually of those eyelids to look at the meibomian glands. They had a follow-up visit 4 weeks after that last treatment. The protocols that were used, so IPL was performed tragus to tragus, kind of using the general sort of dry eye settings. And radio frequency was applied sort of here in that orbital rim area where the skin was heated to 41 degrees Celsius. And then the expression was, again, performed manually on the upper and lower eyelids.
Okay, very interesting. And what did this study end up finding?
So really good results overall. Kind of they showed that they had an improvement, not just in the quality of meibum, so that consistency was changed and improved from kind of a toothpaste to more of a clear or cloudy, but the number of glands that had meibum coming out also increased. So we had more glands expressing a better quality meibum, which resulted in a reduction or improvement in symptoms and improved also the tear film stability. They didn't find an improvement in some inflammatory markers, MMP9 on the ocular surface, but so that was a little bit interesting. But overall, again, the improvement in meibum quality and the number of glands expressing were kind of the key factors there.
Mm-hmm. Yeah, and then the authors of the study did something really interesting at the end of this manuscript. So they actually did a post hoc comparison comparing their results from this
Yeah.
study to another study that was done that only did IPL and meibomian gland expression. So they did a post-hoc comparison with theirs that included radiofrequency compared to one that essentially didn't have radiofrequency, but the rest of the protocols were similar. So can you explain what the authors concluded there?
Yeah, so they wanted to see what was that added benefit, or how did how did those patients benefit from that radio frequency treatment? So when we think back to how radio frequency works, it's applying heat and also stimulating that skin tightening effect, right? So it seemed like that radio frequency, and what they found was that that added heat kind of component after the IPL application sort of really helped to kind of unclog those glands even further, and perhaps even affecting the sort of the eyelid kind of mechanics as well, and the blinking mechanism. So really they found that that RF added to IPL kind of improved even further the number of glands that had meibum expressing, and the quality.
Yeah, that's fascinating. So there's a possible synergistic effect of IPL with radio frequency. Now,
Yeah.
I'm curious. So if most of the benefit with radio frequency comes through heating the meibomian glands prior to expression, do you think that the same outcome could be reached by doing IPL, then warm compresses in office, followed by meibomian gland expression?
Yeah, that's a great point, right? So certainly I think when you think about RF, or any kind of in-office heating treatment, you're really kind of targeting the eyelids themselves. With a warm compress at home or something like that, you have the heat that kind of gets a little bit dispersed to the periocular tissue. So it's more of a directed heat. But you also, again, want to tie back in. I think it's not just the heat necessarily. So I think overall, it's going to improve your blink mechanics again. So
Yeah.
patients may have a lot of those incomplete blinks, that tightening up the skin in and around the eyes can likely improve those, the blinking, and kind of reduce those incomplete blinks, so that you get overall, over time, a better blink that kind of outputs that meibum better, and improving those outcomes to last a little bit longer for patients. I don't know of a specific study that kind of really analyzed that, so that would be great to see, but certainly it makes sense through the mechanisms that can have that effect on blinking.
Yeah, that's a great point, that RF could have some additional benefits over warm compresses by affecting those collagen fibers and the skin tightening and blink mechanics.
Yeah.
So what are the relevant take-home points for our listeners?
So I think the main point that the paper is making, right, is that IPL used in conjunction with radio frequency can really improve meibum quality, as well as the number of meibomian glands outputting lipids, that really kind of improves MGD. And I'm already finding, in my own patients, that while some of them benefit from just IPL alone, so just using IPL alone may kind of have those good effects, there are some patients who just have both inflammation, and they have really blocked meibomian glands. So I'm already starting to kind of add in that heat treatment afterwards, to really kind of work at unblocking those glands, to allow a better quality meibum to be outputted to the surface of the eyes.
Yeah, anything that we can do to have better outcomes is
Yeah,
something I
definitely.
think all of our listeners are interested in. Well, special thanks to Anna Tichenor for joining us today on the Clinical Podcast series, and we'll see you at the next episode.
Thanks so much.
Bye.